Testosterone and cardiovascular controversy finally settled. For years, doctors have worried that testosterone therapy might cause heart attacks. In the early 2010s, a few small studies suggested an increased cardiovascular risk. The FDA got very worried and they added warnings to everything, okay? And overall prescribing from doctors slowed down. So men with low testosterone, especially those with heart disease, were often told it was too risky to supplement testosterone. We've learned a lot since then, and now we have better data, and the results have fundamentally changed the conversation. Today, I'm going to show you what the early studies got wrong, what the largest trial actually found, the real risks you should know about testosterone, and what this means if you're considering testosterone therapy. Let's get into it. When it comes to testosterone and the cardiovascular system, I want to talk about what we used to think. A small trial in 2010 called TOM was stopped early. More men on testosterone were having heart problems compared to those on placebo. Now, headlines warned that testosterone was dangerous, but they didn't tell us a couple things. One, that study only had 209 men, was never designed to measure heart safety, and the participants were frail older men with multiple health problems. Fast forward to 2013-2014. Two observational studies reported that testosterone increased heart attacks and strokes. But these weren't randomized trials, and the researchers just looked back at medical records and tried to find patterns. One study was later criticized so heavily that it actually nearly got retracted. The media exploded anyways, okay? In 2015, FDA responded by adding cardiovascular warnings to every testosterone product in the US and mandated that the manufacturers conduct a large, properly designed safety trial. What was the fallout? Doctors stopped prescribing testosterone to older men and anyone with heart disease. We just were scared, okay? Doctors feared that they'd cause the very heart attacks they were trying to prevent. What's the irony? These are actually the patients most likely to have low testosterone in the first place, since levels naturally decline with age and chronic illness. But for nearly a decade, the people who needed treatment the most were the ones who were denied it. What do we know now about testosterone and the cardiovascular system? Let's start with 2018 to 2022. The FDA mandated trial finally happened. It was called TRAVERSE. It enrolled over 5,200 men aged 45 to 80, and critically, it specifically included men with existing heart disease or high cardiovascular risk. These were exactly the patients doctors had been afraid to treat. Fast forward to June 2023. TRAVERSE published its results in the New England Journal of Medicine. After following men for an average of 33 months, no increase in heart attacks, strokes, or cardiovascular death was seen. The men most feared to be at risk turned out to be safe to treat. In 2024 and 2025, multiple meta-analyses confirmed what TRAVERSE showed, okay? One review analyzed 19 separate studies and reached the same conclusion. Testosterone does not cause heart attacks or strokes. This is big news, guys. So the FDA's own investigation found no causal link between testosterone and cardiovascular events. Okay, what's the verdict? The cardiovascular scare of the 2010s was based on small, flawed studies that couldn't answer the question they claimed to answer. A decade later, the evidence is clear. Testosterone replacement therapy does not increase your risk of heart attack or stroke. The one real risk when it comes to testosterone and the cardiovascular system. So testosterone doesn't cause heart attacks or strokes, okay? But the TRAVERSE trial did find one real risk worth knowing about. Blood clots in the lungs. This is what's called a pulmonary embolism. Why does this happen? Well, testosterone increases your hematocrit. And hematocrit, that's like the percentage of red blood cells in your blood, okay? More red blood cells means thicker blood, which can clot more easily. Okay, but how big is the risk? Well, according to that TRAVERSE study, 0.9% of men on testosterone developed a lung clot compared to 0.5% of men on placebo. Put another way, out of every 10,000 men who start testosterone, about 10 extra men will get a blood clot in the first 6 months. After 6 months, the risk drops back to baseline and your body seems to adjust. So who's most at risk? Well, men with thrombophilia. And thrombophilia is an inherited tendency to clot. The vast majority of reported clots have occurred in these men. Now, men with a history of previous blood clots, interestingly, younger men under 65 may actually have a higher relative risk than older men, though this wasn't showing much statistical significance. Okay, fine. What do we do about this? Well, listen, if you've ever had a blood clot, tell your doctor before starting testosterone. You may need blood thinners, okay? The first 3 to 6 months are the highest risk window, so that's when monitoring matters the most, okay? Watch for warning signs: sudden chest pain, shortness of breath, or leg swelling. And be smart, guys. If you're gonna take testosterone, talk with your doctor and tell them everything in your history, especially if you've got a history of blood clots. Now, I wanna touch on testosterone and atrial fibrillation, which for purposes of this conversation is an irregular heartbeat. The big trial, the TRAVERSE trial, also found a small increase in atrial fibrillation, which is when your heart beats irregularly, okay? Let me tell you the numbers. 3.5% of men on testosterone developed AFib compared to 2.4% on placebo. Overall, 5.2% on testosterone had some type of arrhythmia requiring treatment versus 3.3% in total on placebo. Fine, but what is AFib? Okay, your heart has an electrical system that keeps it beating in rhythm. In atrial fibrillation, the upper chambers, the atria, fire chaotically instead of in sync. You might feel fluttering, racing, or skip beats in your chest. But why does this matter? AFib itself isn't immediately dangerous for most people, but over time it increases your risk of stroke because blood can pool in the heart and form clots. That's why AFib usually requires treatment, either medications to control the rhythm or blood thinners to prevent clots. Now, I want to talk about the uncertainty. Here's the thing. Meta-analyses of multiple testosterone trials haven't shown a consistent link between testosterone and AFib. So, while TRAVERSE found this signal, it's not as clearly established as the blood clot risk. It may be real, or it may have been a chance finding in one trial. Now, in terms of what to do about this, if you already have atrial fibrillation or a history of heart rhythm problems, discuss with your doctor before starting testosterone. This is an important conversation to have. And watch for symptoms, okay? Heart racing or fluttering, feeling like your heart is skipping beats, unusual fatigue, or dizziness. Be smart, guys. The bottom line between testosterone and the cardiovascular controversy is that it's largely settled as of 2023 to 2025. The fear that exploded in the early 2010s, that stuff, it was built on small, poorly designed studies that just weren't equipped to answer what they wanted to answer. In June 2023, the FDA mandated the TRAVERSE trial, and that was published in New England Journal of Medicine, fairly reputable. Over 5,000 men, many with existing heart disease, followed for nearly 3 years. That's good data. The result, no increase in heart attack, no increase in stroke, no increase in cardiovascular death. And since then, guys, multiple meta-analyses have published, and they've all confirmed the same conclusion. 1. Testosterone therapy has not been shown to cause major cardiovascular events like heart attacks and strokes and cardiovascular death, okay? That's the highest quality evidence we have. 2, there is a small increase in blood clot risk, especially in the first 3 to 6 months. We saw this with pulmonary embolisms, which are your lung blood clots. And 3, the TRAVERSE trial also did see slightly more new atrial fib diagnoses, like 3.5% versus 2.4%, though that finding has not been consistently reproduced across pooled data. There you go, guys. That's everything about testosterone and the cardiovascular controversy finally settled. Dr. Merchant out.